Selamat pagi semuanya. Good morning everyone. Mohon izin saya bertanya, Bapak Iqbal apa sudah hadir ya di room Zoom apa belum ya? Our guest speaker. Halo, apa Pak Iqbal sudah ada?
Ya, sudah ada.
Oh, alhamdulillah rabbil alamin. Okay. Thank you Sri Febrianti. Thank you very much for joining this room Zoom. Please mute your speaker and also some channel. Thank you very much. Welcome everyone. How are you today? About the scan one, I will say welcome to all of you. It's very happy to attend and meet face-to-face virtually with you who come from various parts of the Indonesian archipelago, the Philippines, China, and America, was present at this webinar. Our speaker, Dr. Iqbal Pramukti, and then, but we are still waiting for the presence of Professor Mark De Santos from Manila, and we also waiting for our dean from Philippine Women University, Dr. Minerva. They say apologies for the inconvenience that they have many obstacles to join for this activity. Apparently already present in this Zoom room, PhD nursing student under the subject PhDN 6 and protein from the Philippines, China, America, and also from Indonesia. Apparently already present in this Zoom room, leader, staff, and nursing student from Institute of College Hot Dharma Husada Bandung, West Java, Indonesia, Politeknik Harapan Bersama, Tegal, Central Java, Indonesia, Kesdampro, Diponegoro, High School of Hot Science Semarang, Central Java, Indonesia, Kapuas Raya High College of Hot Science, West Kalimantan, Indonesia, and Institute of Hot Business City Party Mahmamuju, Indonesia. Thank you very much. And selamat pagi semuanya, selamat bergabung dalam kegiatan yang positif ini. Good morning for everyone, magandang umaga. And the session will be shared by Mr. Audi. Mr. Audi, please.
We are a united community.
We may not be blood related,
But we patriots are one big family.
Being part of the PWU community strengthens us.
through the years we support each other, through good times and bad times.
We patriots always have each other's back.
It's a big honor to be part of a community that is open to the ideas of each other.
Rise up to excel and be the best version of ourselves.
That's the standard of excellence that we patriots strive for.
I'm thankful that this community lets us be who we want to be.
We thrive because we accept each other for who we are.
And like a family, we treat each other equally.
Actually, PWU gives us a home and helps us to be a patriot in society.
We may have different individual drums and instruments,
but we march to the same beat together as one united community.
Do you want to march with our community of patriots?
I am a patriot.
I am a patriot.
I am a patriot.
I am a patriot.
Good day, participants. This is going to be a fun-filled webinar. Just remember to follow these few online etiquettes for our webinar. Number 1. In line with the Data Privacy Act, we would like to inform you that this webinar is recorded. Your participation means you are giving consent to be recorded. Number 2. Be on time. Be here 10 minutes before the webinar starts. Number 3. Be prepared. Find a quiet place free from distractions. Be sure that your gadget is charged. Use headphones if you have them. Number 4. Keep your microphone on mute. If you would like to speak, click the hand raise icon or say permission to speak, then wait for the facilitator to address your concern. Number 5. Be responsible in the chat box. Use the chat box for webinar-related matters only. Number 6. Take down notes. Writing down notes will help you remember important concepts from the webinar. Number 7. Be fully present. Pay attention to what the speaker is sharing and participate actively. Lastly, number 8. Do not forget to accomplish the attendance and evaluation right after the webinar.
Good morning, everyone. Welcome and thank you for finding time to be with us today. My name is Kusila, Doctor of Philosophy in Nursing student at the Philippine Women University, and I will be your moderator for this webinar. Before we start, I would like to know how my fellow nurses are doing. I know you are all enthusiastic to participate in this webinar. Please type in the chat box and please click the heart reaction so I know, guys, you out there. I'm very excited because in the next few hours, I am affirmative that our participant will learn tremendously from our well-esteemed guest speaker. I would like to acknowledge our participants from all over the world, from United States America, China, Philippines, and of course our beloved country Indonesia. Before we proceed, I would like to inform everyone that we are live via Facebook, YouTube, and Zoom. Please click share so that more of our nursing community may be with us this morning. To prepare ourselves for today's activity, let us begin with the invocation and followed by the singing of the Philippine national anthem and the Indonesian anthem.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, kagasiranganan, alam ng puso, sa titik mo'y kumay, lupang hinirang, kuyagan ng magiting, kaman tulugin, di ka patitigil, nagaganap tulog na simoy at manamit mo pagaw, ay hinagam tula, kawit na pagkayang minamahal, nagkakasang atawad mo'y tagumpay na nagtitigil, makituwin at karanya, kailan pang ay di magtitigil, lumanang araw ng waragit pagsikta, mo'y nangit sa Pilipino. Ang higaya na pagkay mga amin, ang mamatay ng dahil sa'yo.
Good morning once again. We are so happy with your presence and participation in this activity. Since we have started the program, we already have hundreds of people on Instagram Live, YouTube, and on Zoom. These figures are already across our three platforms, so please do not forget to click like, comment, and share your reaction and share this event so that more people will be within our reach. We, the Doctor of Philosophy in Nursing student, currently enrolled in the subject Current Trend and Issue in Nursing Practice, are proud to present you this webinar with the title Governance Policies and Impact to Nursing Practices. For our objective at the end of this webinar, the participant will be able to determine the importance and impact of good governance in nursing, describe good governance approach that will be promote effective service delivery practice in public health, nursing practice, and also in nursing education. And we will be able to integrate good governance in nursing to assess and monitor progress in public health, nursing practice, and also in nursing education. Here are some reminders for this webinar. You can pick speaker to have the platform per hour 60 minutes, and we will conduct the question and answer portion at the end of the session. If you have any question for the speaker, please type them in the live streaming chat box, and we will address all the questions during the question and answer portion. And then I would also like to remind everyone that you will be able to obtain the certificate of attendance after filling up the evaluation form. The evaluation form link will be posted at the end of this webinar. And now let us formally open our program. May I call Mr. Audi Hendakar Monica, represent the committee, to give welcome remark.
Is my voice here clearly?
Yes, Mr. Audi.
Thank you so much for the time. My name is Arti Hinda. I'm the chief of committee of this webinar. The first of all, ladies and gentlemen, distinguished guests, fellow nursing professional, and participants from around the world, welcome to this webinar. This webinar bring to you by Future Doctor of Philosophy in Nursing, Philippine Women's University, Manila. I invite you to embrace this virtual space as a platform for learning, inspiration, and collaboration. Let us seize the opportunity to expand our horizon, amplify our voices, and foster a global community committed to positive change. Together, let us strive for policies that reflect the need of aspiration of both nursing professionals and the patient we serve. Once again, thank you for joining us.
Thank you, Mr. Ardi, for the wonderful opening remark and warm welcome. Now it's time to meet a very popular public figure in the Indonesian and an expert in the field of nursing. May I call on Dr. Iqbal Pramukti, PhD Nursing, Assistant Professor and Senior Lecturer at Pajajaran University, West Java, Indonesia, as our resources speaker. At first, the CV of our resources speaker will be delivered by Mr. Abil Rudi. Mr. Abil Rudi, please.
Okay. Thank you, moderator, for your time. Dear attendees, my name is Abil Rudi. Please of all, I want to greet the Honorable our advisor, Dr. Mark. Good day, sir, and good day for all of attendance. And let me say thank you for the committee for this wonderful webinar. Our title today webinar is Government Policy and the Impact on Nursing Practice, that will bring to us by our speaker. So let's meet our speaker for today. Next. Our speaker today is Mr. Iqbal Pramukti, Bachelor of Nursing, Nurse Profession, Master of Science in Nursing, Doctor of Philosophy in Nursing. He is PhD in Nursing, graduate from National Cheng Kung University, Taiwan. He's all. So Manager of Research, Innovation, and Partnership at Pajajaran University, Indonesia. The attendance. This our speaker work experience. Our speaker start his career 2007 till PT EGC as editor. 2007 till 2008 at Sentosa Bandung International Hospital as XIU nurse. 2008 till 2015 School of Health Science Ahmad Yani Cimahi as lecturer. 2015 till now Faculty of Nursing Pajajaran University as Manager of Research, Innovation, and Partnership. Let's know. Next. Let's know closer our speaker publication. Our speaker is many publication. You can easily find this article on internet. Our speaker concern is current issue of nursing. The speaker research focus is on HIV/AIDS issues. And let's now closer our speaker recognition. Next. Our speaker today, also invited conference speaker is Faculty of Nursing, Pajajaran University Indonesia, June 2020. Faculty of Nursing, Pajajaran University, Indonesia, July 2020. University Pembangunan Veteran Jakarta, Indonesia, August 2020. The 7th Pajajaran International Nursing Conference, Pajajaran University Indonesia, October 5, 2020. The NCKU Epidemic Prevention Scientific Research Center, Taiwan, July 2021. University of the Philippines, Open University, Quest Letter, Philippines, November 2021. Okay. Let's meet our speaker and enjoy the webinar. Mr. Iqbal Pramukti, time is yours. Monggo Pak, silakan.
Ya, thank you Pak Abi and Ibu Kusila. Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. It's my honor to be invited here in the excellent webinar provided by the committee from the Philippines Women's University, especially for the doctoral students. I think it's my honor to be here and invited by my colleagues like Ibu Kusila and the others. Of course, as scholars, it is our pleasure and our responsibility to share our knowledge to others about the current issue related to our field. And for today, I'm going to talk about the government health policy and its implication or impact on nursing practices. May I share my screen? Okay, excuse me. Can you hear my voice? Is it clearly?
Yes, Doc.
Okay, thank you. Yeah, just want to make sure because I use my earphone and wireless, and sometimes it doesn't really hear in a good condition. So for today's topic is about government health policy and its impact on nursing practice. And this is my name, Subha Pramukti. I'm an assistant professor and secretary of nursing university Jalan. And this is my contact. If you want to contact me, please contact me through this WhatsApp or email or even through my Facebook or my Instagram. Yeah, before we talk about the policy, especially health policy on nursing practice, we have to know first what exactly the policies mean. So according to Alsop and friends in college in 1905, a policy is a kind of decision or action reflecting decision that is made by the government, and it will be prioritized to address the areas of concern. So here, the policies mean that something created or something issued by the government, by the official government or the society, to relate to some issue. For example, if like about 2 years ago, we have a pandemic, so about COVID-19. So of course, in Indonesia, there are several policies related to COVID-19 because the government has a concern that the COVID-19 become a pandemic and also a national issue that should be solved in a short time. And then, related with the health, where the policy focuses on health, the government will aim to change its practice and then delivery and financing by directing the activities of healthcare organizations. So according to this, when we talk about policies and its relation to the health, so it will be a connection between the government and also the healthcare organization. As you know, in Indonesia, we have several healthcare organizations. Like for nursing, we have the PPNI or Indonesian Nurses Association, and also like other organizations like kind of the association of we call it IDNI or other organization related with PPNI or IDNI. So, and then when we talk about policy, there are 4 elements related. The first one is legislation, and then regulation, policy, and guidelines. So let's see one by one. The first is legislation. What does legislation mean? Legislation is kind of the broad circle in our country or even in the world. It will cover regulation, policy, and guidelines. So as a basic is a legislation. Without legislation, we don't have any underlying law or underpin law that can cover the policy or even the guideline in the future when we want to have a program and we want to implement some program to solve some problem related to national issues. And then so this in here, after regulation, we have the regulation. In regulation, it's kind of a rule, something that we have to obey. So in regulation, it aims to control and maintain standards in health and social care. If you talk about health issues, so a regulatory duty can be ascribed to an organization by legislation. So from the legislation, there will be a regulation, and then regulation will assign some organization related to manage or to control or to implement some program related to the issues underpinned. And then we have the policy. What exactly policy? Policy is a kind of goals, ideas, and priorities that are by the government. And so it can be in form of legislation and regulation. So through the legislation and the regulation, policy is issued. Okay. For example, like a couple of years ago, we have about COVID-19. We have a policy about to wear a mask, and then to do like self-care protection and to avoid crowded. It's a policy. And after the policy, we have the guideline. A guideline is more structured, it's more operational, how to implement the policy. For example, the government wants to control the COVID-19 spreading issue to make sure the safety of Indonesian citizens, for example, in Indonesia. And then, so based on the policy, there are some guidelines. So in guideline, there is very detailed information how to wear, what kind of mask that we have to use, and then how many meters we have to avoid. I mean, we have to stay away from others, and what should we do and what should not do, something like that. So legislation, regulation, policy, and guidelines are the elements that are important when we talk about government health policy. Okay, let's continue with the how policy influence and the policy influences and development. So talk about the policy and its relation to this health policy. Of course, it will be a connection. I mean, it will be a relation that will be a bridge to connect between policy and the implementation program. So there's a scientific research here. So one area where scientific research has driven policy that directly affect the nursing profession is in tackling universal public health concerns such as smoking, alcohol and sugar intake, and exercise, for example. Yeah. In here, we have the problem. There's an issue about the smoking behavior and also the alcohol consumption that is very high in some countries. So related with this issue, so the government's policy has emphasized a kind of research how to tackle this issue. So here we know that research or the scientific research has taken an important role to manage and how to standardize the guidelines or even the program that should be issued or should be implemented as the implementation of the policy. So before we go to talk in Indonesia, we will talk in other countries like in UK. The health policy and the relation to care of people with long-term condition in UK. Here, we can see the table here. There are policy category, intervention, and the contribution from behavior and social sciences. So when we talk about health policy and its relation to some issue in here in UK, they talk about long-term care because they have many people who are in the aging, like they are already old, like they have more and more aged people. So therefore, they make a program called long-term condition. How this long-term care implemented? The first thing in the policy level, there is a legislation. In legislation level here, the intervention is the government bans on tobacco and tobacco in the press, and then prohibit the names such as light or mild in advertising, and then they increase the legal smoking age from 16 to 18. And then they also ban smoking in public places, workplace and cars, and then mandating factorial warning on cigarette packets, and ban on point of sale tobacco. So this is the kind, these are the kind of legislation intervention. In legislation level, there are some intervention. Okay. So what is the research underpin? Here are the contribution from behavior and social sciences. In here, why they do this? because of the finding, because of the recommendation from the research, there is saying that social science research contributes to the evidence base that should ban on advertising and restriction on marketing. So they found that legislative measures can increase smoking cessation. So this is based on the finding, based on the research. So therefore, because of this finding, so the researcher recommended to the legislative. The legislative, they released the intervention like this. Okay. So this is only for the legislation level. And then for the fiscal measure, so how they act in fiscal measure to support this policy that is released by the legislature. So they increase the cost of tobacco products. So why they do is because of the finding of the research say that reducing the affordability of tobacco can reduce smoking amongst young people and those of low socioeconomic status. So they hope by increasing the cost of tobacco, so it can limit the affordability of people to buy the smoke, to buy cigarettes. So therefore, the prevalence of smoking will be decreased. And then we continue to the guideline level. So in guideline level in the UK, for example, related with the tobacco control, they have the National Tobacco Control Strategy and then national guidelines to support the implementation of local stop smoking services, and then tobacco harm reduction, guidance on e-cigarettes, and guidance for the training of stop smoking advisors and specialists. So they have this. So why they have this? How they make this guideline? It is based on this contribution from the researchers, based on a training program underpinned by the evidence. Then the website provides an overview of the evidence in the area, including the recommendations from academic work. So if we can see the cycle here, starting from the evidence, starting from the issue released by the government, and then the researcher will do the research. Okay. After they find something interested, and then it can be a recommendation. So they recommend the legislative to release some intervention, start from the legislative level and then the fiscal measure, and also they will make a guideline after the legislative approve the recommendation. And then when we talk about the how the relation between the research or the behavioral science, social science discipline to the legislation of the health policy. As you can see here, there is a study by Adrian et al. And that found that here there are some components related with the changes of behavior and also related with the health policy. In here that we can see that there are some policy and then environment and social system, and then community and neighborhood, family and friend and person, and biological. And then here we can see there is the involvement of the psychology, sociology, anthropology, and economic, and also the biology and medicine. And here we can see also the involvement of the socioeconomic, culture, environment, and living and working conditions, and the other social matters. Here and inside the people, they also some factors that will be related, like the genetic and then biological, biochemical research, linguistics, psychology, health economic, and the others in here. So this factor will influence how the policy will be made. And then we will talk about the policy. What is exactly the policy process implemented in nursing action? There is a model by the Anderson. There are 5-stage model. The first stage to implement the policy into the nursing action is getting ideas onto the agenda. For example, because later I'm going to talk about the HIV agenda, HIV issue, and HIV policy. So here we will talk about the HIV. So, for example, the idea is the researcher get the idea of the current issue of the HIV epidemic and also the AIDS epidemic and also, for example, the ART. ART is the antiretroviral therapy. There is some issue found that there's some complaint by some community that there's a limitation of the ART. So therefore, some people cannot reach the ART even though they are HIV positive. And also another issue is like the government has implemented the national guideline or even the national program to respond to HIV epidemic. However, why the HIV condition or HIV epidemic is still high, or the prevalence of HIV is still high? So that's the idea. So that is the idea that should be implemented in the next action. So after that, there is the reformulating the policy. So after here, the government will evaluate whether the previous policy is effective or not, whether the policy can reach the goal or not. So afterwards, they will think about how is it time to formulate to reformulate the policy, and then after this, there will be an adoption. What is the meaning of adoption here? Adoption is how the researcher and also the stakeholders in the society and in the community catch the goals and the national policy related with some issue. For example, here in about HIV. So it will catch by the non-government organization, for example, and also by the researcher and also by the academy and the other stakeholders. So they will work based on their field. So the researcher will do the research, and the NGO will do some campaign, something like that. So when they do the adoption, there will be the implementation. This implementation will be based on the recommendation by the stakeholders, like from the researcher, from the NGO, and the others. And afterwards, they will do the evaluation. So here, there will be a cycle. It's always a cycle. After the evaluation, we will find whether the program, based on the policy made, is reach the goal or not. If yes, so maybe it will stop, or even they will continue the program as a sustained program, or even when they found that it's not effective, they will rethink. They will think about, do we have to create a new policy and to reach the goal, something like that. So then here we will talk about how the health policy affects nursing care. Excuse me, I think my voice. There's some problem in my face. So may I have a second? I will get my seat first. Excuse me. Okay. Sorry. Apologize for the inconvenience. So next, we talk about how health policy affects nursing care. According to NSC studies, that's published in British Journal of Nursing. So it's about the topic is the implication of health policy for nursing. Here, the effect of policy on nursing. The first is location of care. Based on the policy, if the policy are related, or if the policy is supported the issue that should be solved by nursing profession, it can move the nursing closer to home and away from inpatient facilities. So nurses are caring for sick patients at home. So based on this, how the health policy affect nursing care? So based on the policy, the patient can the number of patients can be decreased in the inpatient. So most of them can be moved to the outpatient or even at home. So, for example, like before, for those who are get sick, they have to stay in the hospital for about up to 5 or 10 days. So because of some policy, so the length of stay will be decreased, and the rest they will get the further nursing care in at home or even in outpatient care. And then, based on the health policy on the affecting nursing care, is the focus from treatment to the promotion of health and prevention of illness, so that nurses are working more directly across the lifespan in a less episodic way. So from here, we can know that based on the policy, the aim or the goal is to reduce costs to finance the sick people. So therefore, the government here plan to move the treatment from promotion of health, from treatment to the promotion of health. So therefore, the kind of action or the kind of program in nursing care will be more in promotion action or preventive action. And then the third is the roles and responsibilities. So in here, it will direct nurse to work in the integrated team. So before maybe they just work nurse as a nurse, and then doctor as a doctor, and then the pharmacist, and they just work on based on like their box without collaboration. And here, this because of the policy, the roles and responsibility changes to it will direct the nurse to work integrated team, because it can bridge the health and social care and adapt to an integrated model of the delivery around multiple health conditions rather than single disease. Because as you know that when someone sick, when someone gets a disease, so there might be another disease that is interacting with each other. So by doing the integrated team, by involved in integrated teams, they can do a comprehensive treatment and comprehensive nursing care to solve the multiple health conditions. And the fourth is the health model. So in here, taking nursing away from the traditional biomedical health model to a greater appreciation of wider health determinants. So in here, the idea of integrating health in all policies. So these are the four effects of the health policy on nursing care. So now we talk, especially in Indonesia, how the universal health coverage as a national health policy in Indonesia. It's called JKN, or Jaminan Kesehatan Nasional, or it's kind of universal health coverage, or we call BPJS Kesehatan. So the act under PBKP, there are some acts here, like from Undang-Undang Nomor 40 in 2004, and then Undang-Undang Nomor 36 in 2009, and these are the act under the BPJS, or the universal health coverage. And the program design in Indonesia is like this. This is the regulator, and this is the BPJS. The regulator means that the government, and this one is the committee, or the in charge for those who in charge, or the organizations in charge the universal health coverage. We call it BPJS Kesehatan. And then this one the healthcare facility, and this is the people. So they interact with each other, and they have their own goal, and there's a system also here. And from the government, there's a regulation, and there is a standardization, and also there's a regulation about how they make a guideline. So therefore, they are a cost and how to do, like for example, if someone sick, so how can they get a treatment? They have to go to this therapy first, and to this after this. So this are based on the guideline. The guideline is based on the regulation, as I mentioned before, and the regulation based on the legislation found by the legislative. So how the impact of the JKN on healthcare in Indonesia? There's some evidence here published in International Journal of Public Health, published by Erlangga et al. JKN can increase the probability of inpatient admission for the contributory and subsidized groups by 8.2% and 1.8%. So it means that for the contributory means that those who pay by themselves for the premium, and subsidized, those are paid by the government for their premium. So both groups are increased for the probability of inpatient admission, so 8.2 and 1.8 respectively. And in here, the contributory group has an increase in probability of an patient visit of 7.9%, which means that, what does it mean? After the JKN released by the government, the probability of inpatient admission getting increased. So now we move to the special policy on HIV. So this one is a project that now I'm working on, and especially we are working to reduce the HIV transmission among sex workers to the general people. So we call intervention strategy among sex workers as high risk group in Indonesia. As we know that HIV in Indonesia first identified in Bali in 1987. So afterwards, the prevalence of disease became higher and higher. And then the prevalence of HIV in Indonesia between one decade, between 1997 to 2007, has been increased 40 times. Can you imagine? It's 40 times increase. And then even the aggregate national prevalence is still low. So it's over the aggregate national prevalence. That's about 0.16%. But the rate increasing is high this year. And based on this, the sex worker has main role since this group labeled as high risk group, according to the Director of CDC Indonesia 2015. So here, until 2023, the epidemic of HIV in Indonesia is over 500,000 people living with HIV. Yeah, and this almost all areas in Indonesia has been affected by the HIV epidemic here. So the key population among the people with HIV here, there are sex workers, gay men, and people who inject drugs, and transgender people, and the prisoners. Now my project is started with the sex workers first, and after we will work step by step. We plan to work on these 5 key populations. And so, how about the trend of HIV infection rate? Based on the Ministry of Health in 2016, the trend of the infection rate will be increased and increased. Yeah, in here until 2015, yeah, we apologize because this data is not updated. It's not only until 2016, but in here we can see that the trend is getting high and high until 2015. And this about the trend of HIV infection according to transmission mode. Until 2025, there will be an increase. So here, for the female tourists and female sex workers here, the color is red and also green here. We also getting increase. So, and then another data is about the distribution of transmission mode. The cumulative case of AIDS in 2016 based on mode of transmission, the heterosexual mode is the higher one. What does it mean? It means that the sex worker has an important role to contribute to this infection mode, because the heterosexual, which means that it can be from the interaction between the sex worker and the, yeah, we call it customer, or even the general people. So there is an important role to be solved. So why the sex worker has a high population? Currently, in Indonesia, the commercial sex still still widespread. And even though the government has closed some prostitution area, but still there are we call it the invisible transaction, because as long as the demand there, so the supply will be there. There's an economic how to say, the economic law. As long as the demand there, so the supply will be there also. So because many people want to have like kind of commercial sex, so the provider will be there also. And then between 6 to 16% of direct female sex workers and 2 to 9% of indirect female sex workers were infected by the HIV. So the sex worker here has been not in prostitution, and it can cause the risk of getting HIV transmitted. And then here, the many social and structural factors can make it difficult to prevent and treat HIV among persons who do this exchange for money or non-monetary items, according to CDC Ministry of Health. So in here, we have the phenomena that is very dangerous if we don't do some action to stop this prevention, to stop this spreading of the disease. So therefore, my project here, we call the sex work as high-risk population. There's a number and HIV prevalence and what they do here, and how high those who are using condom among clients. In here, we can see that the number is getting high and high, and then HIV prevalence also high, about 10.2%. And the type is like the direct female sexual workers, over sexual intercourse is surface indirect. And for the indirect FSW is over surface, which can result in sexual intercourse. And then here, those who are using condoms only less than 70%. And for the male sex worker, less than 80%, which means that there are still many people who are doing this without protection. So it's very dangerous to spread the disease. And then based on this, we have when we want to do the prevention, there's a challenges. The first is the lack of data, because as we know that when we talk about HIV in many countries, including in Indonesia, it still becomes a taboo, or like they don't want to. If someone gets HIV, they want people know whether they're infected or not. And if they're a risky group, they don't want to do the test because they're afraid if they're HIV positive, so they will. So they think that the work is over, so they can do anything. They just can do nothing. So they cannot get a job. They will get fired if they're working, or their spouse will ask for divorce, and the society will treat them as a bad community, something like that. The stigma is still there. Even we know that the HIV person, not only those who are doing the negative behavior. How about the women who get infected by their husband? How about the children who get this disease infected by the mother through the transmission when they are in their during the pregnancy? How about that? So they are the innocent people who get HIV without doing nothing. So therefore, we have to do the action to prevent the disease, to stop the stigma, because stigma still can cause the people. The coverage of the HIV prevalence is still like the iceberg phenomenon. And then because of the socioeconomic factor, the stigma, and also the sexual risky behavior, like person who exchange sex may not use condom consistently due to unequal sex partner relationship, like client has more preference to choose, and also about the drug and alcohol. The kind of sex work under alcohol can impair judgmental or sexual behavior, might lose control of using condoms. So this is the changes, these are the challenges to do the prevention program. So, what is the response to HIV/AIDS among sexual workers in Indonesia? Again, we go back to the policy. In Indonesia, actually, the government have already have a good policy. Like the first, the government provides the ART for free to those who are HIV infected. It's for free. So they just do the test and they're positive. They can get a treatment. I mean, they can get a consultation and they will get the ART for the whole life, the lifespan. And the second is Indonesia also has already started to provide prophylaxis exposure prevention, like it's kind of medicine or a drug for the couple. For example, if there's an HIV person, so the spouse, for example, there's a spouse, husband and wife, and the husband is HIV positive, and the wife is still HIV negative. So this wife will get the medicine, will get drug, will get a kind of ART. We call it PrEP, prophylaxis exposure prevention, to prevent the spread of the disease by the husband. So it's kind of PrEP, only provided to those who are in risky. For example, the couple, like the couple of the HIV person, or those like who get how would say a rogue. I mean, they got rogue, and then prisoners, for example. Yeah. So only for some key population. So based on the policies released by the government, the HIV Indonesia deserves special attention and analysis. So the variety of Indonesian culture, because of the variety of Indonesian culture and religion, so the initial response were by the civil society, including non-government organizations. So from 1995, the Indonesia's response to HIV/AIDS is more systematically. We have the global program on AIDS, then the newly established UN joint based on the WHO program. So Indonesia has implemented systematic zero surveillance among sex workers for 16 sentinel sites. And the Act Against HIV, again, we have already the Act, a national campaign which focuses on fighting stigma and reduce risk of infection among risk population. Actually, the government's part, they do a good job. I mean, they already have an act, they have already a program, a national program to stop the HIV transmission. However, why the case still there? Why it's still a messy program? So that's something that we have to do, especially by the nurse who taking care of people living with HIV. So based on this, we address the problem that is based on evidence found that it is describing the increasing number of sexual workers, even there is still lack of exact data together. And the number of clients is getting higher every year, so the risk of widespread of HIV positive. And then the sexual over always there since the environment is supported, as I mentioned before, based on the economic law, as long as the demand there, so the supply will be there, And response from the government is not comprehensive and likely intermittent. Yeah, even though, as I mentioned before, even though the program is good enough, but the implementation is still intermittent. Sometimes it is implemented if the government push on, but sometimes like it becomes later, like it's passive because of the government not focused anymore. They change with another issue, something like that. So this become a problem. So therefore, in this project, we do we call intervention strategy in small group level. In small group level, the intervention strategy is the first is build the HIV aware peer group among adults and initiated by the government and health profession, which the purpose and the aim is to guide adults in a positive activity in order to prevent HIV transmission here. And the second is involving the sexual worker in the HIV campaign. And the purpose of this strategy is to share the experience and to provide peer support for them. And the last is the sexual education for sexual groups, which involving health volunteers. And this purpose is to gain adequate knowledge among sexual workers in order to prevent HIV transmission. So these three strategies, we do it in a small group level. And then how about the monitoring implementation? For the peer group, we did a field survey by the government and also health professional. And then for the we do also involving the sexual worker to monitor the implementation. And we will give some credit points to health center, which conducted campaign program involving sex worker. And then sexual education, there's a field survey to the sex worker about the program, whether it has been done or not. About the evaluation for the peer group, we have the number of active adults. So the indicator is for the peer group, whether the number of active adults and member in the group is getting increased or not, and how about the quality of the program conducted by the peer group. And for the involving sexual workers, the indicator of the evaluation outcome is the number of sex workers who involved in HIV campaign, and then the activity done by the sex worker when involved in the HIV campaign. And for the sexual education, by check routinely the knowledge of sex worker by inviting into some HIV seminars. So of course, we'll not legalize the sex worker, but we try to stop them to transmit the disease to the others. So we keep do the sexual education, and not only to the sex worker, but also to the general population, especially to the start from the young adults to the adult people. And about the disciplinary expertise requirement, for the peer group, we involve the community nurse and the HIV certified general practitioner. And for the involving sexual worker, the disciplinary expertise requirement is the public health, political expert, and a community nurse. And for the sexual education, we invite the community nurse and HIV certified general practitioner. So these people are the experts. These people are those who are officially work on HIV care in Indonesia. So aside from the issue that I mentioned before, there are another issue that we have to be more aware. The first is about the comorbidity for those who are living with HIV. This is my article published in PLOS One about this meta-analysis about bone fracture among people with HIV. And so here we found that the prevalence of HIV in global in the world, and then what kind of factors affecting the risk of factor, and how this factor can be managed. And then the next is about the issue among the adults or among high school students. So the internet usage and risky sexual behavior also an important issue that's happening among the high school students and can cause risky sexual behavior among them. And the third, also my article published in Journal of Infection Public Health, there is another comorbidity, there is HCV co-infection or hepatitis co-infection. So those with hepatitis co-infection are associated with a higher fracture risk compared to HIV infected person without HIV, or even compared to general population. So here we found that policy in Indonesia affecting nursing practices, of course, yes, it's very affecting, because based on the policy made by the government, so they can the nurse can do a further action started from the previous I mentioned that 5 stages in the model, start from the how to interpret, how to getting the idea, and then the adoption, and then they can do the further action. And I think that's all for my presentation. And if you have some questions, please don't be hesitate to write, to put on the chat box, or even you can raise your hand and turn on your microphone. Thank you.
Thank you very much, Dr. Iqbal Pramukti. We are truly grateful for your presence. Thank you for elevating the nursing profession and for your continued support to all our nurses and of course future nurses. And then I think we agree that all health workers need to promote government policies about act against HIV. We need to uh, focus on fighting stigma. I think it's very important to do to limitation the numbering of HIV in Indonesia. And then thank you. And how we and now we move forward to our discussion session based on the responses found in the Google GPOM yesterday. It's known that the participants were very enthusiastic about the topic presented by Dr. Iqbal. And according to our agreement at the beginning of the activity, we got two questions, the opportunity to get an explanation from Dr. Iqbal. Mr. Aldi, would you please share the question for Dr. Iqbal? We will proceed with the question and answer portion. We have collected some of the question that the participants have submitted during the registration for this webinar. Here is our first question coming from one of the participants, Dr. Iqbal. Government policies and nursing practices are very important. We feel that many acts of nursing practice are delegation of medical authority. For example, in the emergency department, in patient with tantrum or patient with severe bleeding, nurses carry out emergency intervention in the form of administering sedative or suturing wound. If the patient is safe, then this action is considered legal. But if there is a condition where a mis-error occurs, this is certainly bad news for the nurse. Who will protect us? I hope Dr. Iqbal is willing to provide advice regarding the delegation of authority. Dr. Iqbal, please welcome to provide the response regarding to the first question.
Okay, thank you, Ibu Priscilla. So thank you for a great question. It's very good question. I hope I can answer the question. Yeah, we will talk about the delegation. Yeah, it's become like a gray area. I mean, why we call it a gray area? Because sometimes the other profession, like the medical profession, just delegate the case on delegate the intervention on the delegate something to the nurse without appraise the legal issue first, and the second without appraise the competency of the nurses first. So if they can do the good appraisal, so the error, I think it might be not happening in the future. But if they do the good appraisal, so of course there may be probability of getting an error. So like for the nurse, like we have also like the leveling of the nurse stuff. We call PETA, I don't know in English. Level 1, level 2, level 3, level 4, if I'm not mistaken. So it will describe how competent the nurse, how this nurse or the nurse can do the intervention or the action. And the second is, even though when the medical staff or the doctor, for example, they have already delegated, so still the responsibility belongs to because it belongs to the medical responsibilities. So therefore, before they do the delegation, the medical should appraise the competency of the nurse and of the someone who are delegated by them. So if they can do a good appraisal, so of course they can end the error can be prevented. And the second is even though they didn't the delegate, so the someone who do the delegation should observe. I mean, should do the supervision, even without, for example, if they are not there, but at least they keep maintained or observed by telephone, or they can use another technology. For example, like now we have the video conference, like what video call or something, so they can make sure that they do it correctly. So if you are asking me about who is still responsible, yeah, because as delegation, and it's still based on the act, is based on the medical professional responsible. It still belongs to their responsible. So therefore, before they do the delegation, they have to appraise whether these people are competent to do that. That's my answer.
Okay, thank you very much for that insightful answer, Dr. Iqbal. I think we are all also agree that health worker need to doing practice according to the competencies, and then health worker need to adding knowledge about SOP, standard operational procedure, and using high technology. Thank you very much once more for insightful answer, Dr. Iqbal. And we still have our next question, Dr. Iqbal. The next question is, sometimes there are gaps between health policies and health service practice. Dr. Iqbal will need suggestion on action to minimize the gap. For example, practically, we have to act immediately on patient with accident due to fracture of the leg. But BPJS policy require that all administrative requirements are met. Dr. Iqbal, please welcome to provide response regarding to the second question.
Yeah, for this very good question also. Yeah, I think for this one, if the question is about how to minimize the gap. Yeah, of course, the gap was there. Like we can minimize the gap, not too huge. The first is we have to know first who are in charge to do that action. I mean, whether the nurse are eligible to do this. Yeah, if they are eligible to do this, so of course they can do this action. And the second is the principle in the healthcare, health for people and all for health, if I'm not mistaken. So we have to put the patient preference and patient safety as the first priority. So in the emergency situation, of course, we can do, we can do an emergency action without, the administrative ones can be afterward. But don't forget, we still have to inform them that something that we do this is kind of emergency situation. So while we do that, so we have to ask the family of the patient to finish the administrative process. And of course, like in my understanding, in Indonesia, for those like they are, but let's say they don't have the BPJS, they exactly don't have BPJS at all, and then they come, and then when the reason why they don't have the BPJS, they can have like there's some budget allocation in every city. So the government use the local APBD, or how to say in English, the local resource based on their financing plan. So they have it, but just different shape. Like in Kota Bandung, in Bandung City, we have the UHC or Universal Health Coverage card, and then in another word, other city they have to provide the letter from the local authorized authority, for example, SKPM we call it in Indonesia, something like that, and they can do this afterwards. So, but the first priority is the patient safety. So the nurse should take an action immediately to take care of the patient. So that's it will be accordingly to the WHO campaign like Health for All and All for Health. And based on this, patient safety will be the priority first. So yeah, am I answering the question?
Okay. Thank you so much, Dr. Iqbal. Thank you so much, Dr. Iqbal Priamukti, for the very informative and substantial presentation and answer to the question for our participant. So the participant for the second one is we have to put priority. It's very important and build coordination in all sectors to communication and to provide service, public service. I think we are all agree with Dr. Iqbal explanation. Thank you very much, Dr. Iqbal. We will see you later in the awarding of certificate. And the next session is an inspirational message session, which will be delivered by Mr. Iksan. Please, Mr. Iksan.
Pak Iksan suaranya.
Okay. I'm sorry. Okay. Thank you, Ms. Kucila, as the moderator. My name is Iksan Ibrahim, Sarawak Sadang of Nursing, Philippine Women University. So, I hope everyone is trying to learn more about our topic for today on behalf more elaboration and understanding of the government policies and impact on nursing practices. That is all, and thank you.
Thank you, Mr. Iksan, for the inspirational message. And let's take part in the intermission session in this webinar.
Saat semua menghilang, kau tetap setia menjaga. Kau berkorban tanpa suara demi senyum yang lain. Saat semua tertidur, kau terjaga sepanjang waktu. Lupakan lelah ragamu demi raga yang lain. Dunia telah tersenyum melihat kau bertaruh nyawa. Tak pedulikan yang kau punya demi raga yang lain. Engkau pahlawan dunia, Tuhan yang kan membalas semua. Jerih lelah yang tak ternilai demi raga yang lain.
Tenaga kesehatan, baik dokter maupun perawat, kini menjadi garda terdepan dalam menangani pasien positif COVID-19. Sudah ada korban tenaga medis meninggal dunia dan ada pula yang terinfeksi setelah merawat pasien COVID-19.
Walau hampir tiada sudut untukmu menghela nafasmu, teriring doa untukmu, suara ini untukmu. Dunia telah tersenyum melihat kau bertaruh nyawa. Tak pedulikan yang
Thank you. Thank you very much for that very wonderful and heartfelt video presentation. The title of the intermission is Demi Raga Yang Lain in Bahasa or Para Sa Ibang Katawan in Tagalog or For Another Body in English. And now we will proceed with the awarding of certificates. To help us express our gratitude to our expert resource speaker, it's my honor and privilege to call on Mr. Ardi, represent the committee, to awarding certificate to Dr. Iqbal Pramukti.
Okay. Is my voice here clearly?
Yes.
Thank
Yes,
you so much
Esther.
for the opportunity. Ladies and gentlemen, distinguished guests, and our esteemed webinar speakers, and our speaker has demonstrated exemplary expertise, profound knowledge, and appreciation for this subject matter. The certified symbolize our science care gratitude for your Committee of Education. Your unwavering dedication to sharing knowledge and your valuable contribution to the success of this webinar. My this certificate serves as a reminder of your significant achievement and the positive influence you have had on all those who had the pleasure of attending this webinar. Once again, thank you for enriching our webinar with your invaluable contribution. Once again, thank you so much, Sir Iqbal Pramukti.
Thank you. My pleasure, Dr. Adi and the others. Thank you so much.
Mr. Iqbal, do you want to say something?
Thank you again, Ibu Kusila, Pak Ardi, and other college and all participants. It's my honor to be here, and I hope that my speech can provide something new for adding information in our nursing practices. And I do apologize if even my speech is not fulfill your expectation, but I do really hope that through this seminar we will gain an insight to move forward to raise the nursing, to make a nursing practice in Indonesia become great and great. So therefore, thank you again.
Thank you very much, Dr. Iqbal. And thank you very much for Mr. Ardi for awarding the certificate to our resource speaker. I would like to inform everyone that this webinar will be aired at the Genbes Dharma Husada live Dharma Husada, and also in live Zoom and in the Facebook. We would also like to give appreciation to our very supportive professor, Dr. Mark Santos, and then our very inspirative professor, and also the Dean of School of Nursing, Dr. Minerva De Ala. And then without your guidance and effort, this webinar will not be a success. Thank you very much. We are indebted to the leader and staff from our respective workplaces who provide the best assistance to us. Apparently already present in this Zoom room, leader, staff, and nursing students from Institute of College Health Dharma Husada Bandung, West Java, Indonesia, Politeknik Harapan Bersama, Tegal, Central Java, Indonesia, Kesdam Pro Diponegoro, High School of Health Science, Semarang, Central Java, Indonesia, Kapuas Raya High College of Health Science, West Kalimantan, Indonesia, Institute of Health Business Siti Fatimah Mamuju, Indonesia. Without your support, it would be impossible for us to be united in a doctoral philosophy in nursing class in the Philippines. We also really appreciate the support, cooperation, and coordination of many parties in this webinar activity. Dr. Winiel Sanchez as delegate leader from the Philippines, Ma'am Gracie Soto Sabal as class secretary of PHDN 614, the leader Group 1, 3, and 4, and all classmates in current train and ISU in nursing subject. The group dynamic and cooperation of PhD nursing students who come from foreign countries have fostered a sense of brotherhood and mutual respect among us. I would also like to acknowledge the men and women behind the organizing committee, SIP Committee, Kusila Devia Rahayu, Communication and Documentation Committee, Aldi Hendakal Mandika, Program Committee, Iksan Ibrahim, Technical Committee, Muhammad Asad Effendi, Template and Layout Committee, Abil Rudi, Finance and Budget Committee, Dwi Mulyanda. Before we end our program, may I invite our inspirational speaker, Dr. Iqbal Pramukti, our supportive professor, Dr. Mark De Santos, the annual Dean of School of Nursing, Philippine Women University, Dr. Minerva De Ala, the delegate of Philippine student, Dr. Winiel Sanchez, the secretary of Philippine student, Ms. Gracie Soto Sabal, the chairperson of Group 1, Mr. Kenneth Lubigan, the chairperson of Group 3, Mr. Irawan Danis Maya, the chairperson of Group 4, Mr. Galih Jatnika, the committee of this webinar, all classmates in the PHDN 614, and the participant to get documentation. Please open your camera. And for Mr. Asad and Mr. Deris, please take documentation. Apakah sudah bisa dimulai? Open your camera.
Okay. Sure.
Okay. Slide 1, 2, 3.
Thank you. Number 1, number 2, number 3.
Okay. Slide 1, 2, 3.
Ada Pak Henry ya?
Okay. 1, 2, 3. Okay. Sip.
Sudah semua? Okay. Okay, thank you very much. What's your? We have to open camera. What's your? Oh, okay, it's okay. Okay, thank you very much for all. And then we will finally, we would like to thank everyone for attending and actively participating in this webinar. We hope that you will able to learn so much about and apply our learning when you go back to your institution. To our dear participants, the evaluation link are now posted. Please accomplish the form and submit accordingly. The certificate of attendance will be sent to you immediately after you have submitted your evaluation. On behalf of PhD Student Nursing of Philippine Women University, thanks to everyone and our prayer for your health and success. May the grace of Allah Subhanahu wa Ta'ala be with us. Mr. Abil, please share evaluation wing.
Yes.
Let the Father of the great
To all participants, please allow the committee. Yes. Hello to all participants. Please allow us, the committee, to end the room Zoom. Thank you very much for the participating and join this activity. See you on next webinar. See you all.
See
Thank
you
you very
all.
much.
See you all. Thank you so much for
Dr.
participating
Kenneth,
with us.
thank you very much for coming.
Thank you very much.
Thank you, doctor.
Thank you very much.
Thank you, Doctor.
Most welcome, everyone. See you.
See you.
See you.
No, stop na recording. Nyimpannya nih di, kirim nih gimana? Kirim di 3 kali.
Recording stopped.
See you guys.